trend of addressing medical problems before they appear is developing. Preventative medicine is the topic we're discussing today, and I'm joined by Nicholas Stuckey, General Director at Incorpore Medical Centre, to find out more. Welcome, Nicholas.
Thank you very much for receiving me.
So the prevention side of medical problems is being developed more in the medical sector. So can you explain the process a little bit further?
Yeah, well, a lot of people who are in good health want to check themselves. They want to stay in good health, they want to live longer, they want to live in a good way of life. So before, what they were doing is just going to a doctor and just checking themselves. So having an image on the moment. But what is more and more interesting is to have an image on the long term. So there are many blood analyses or genetic analysis that you can also do now that help people improving their life with nutrition, with alimentary supplements. And it's very interesting because this can be personalized, meaning on your blood analysis, your genetic type, etc., etc. The doctor can really help you adapting your food, your lifestyle to you, especially to you, and it's very individualized. And that's what's very interesting for a lot of people that are really in good shape. It can start already at 20 years old, 30 years old, 40 years old, not already when you're 50. So it addresses to everyone, and it's becoming more and more and more trendy, especially in Switzerland, in our top level medicine.
So how is it beneficial then to treat a patient for a disease or a medical problem that they don't actually have yet?
Well, let's talk about oncology, cancer. I'm in a good health, but maybe I have in my past, in my history, in my family history, they may have problems, or you don't know. Angelina Jolie, she did her genetic test. The genetic test showed that she may have cancer later, breast cancer or ovarian cancer. So she decided to act. People can decide to act, people cannot decide to act, it's their decision. But medicine is becoming more and more and more sophisticated that you can prevent something of coming with those analyses. Now, it's your decision, the patient's decisions, if he wants to deal with that or not. But if you can have this tool, why not?
So see, addressing a problem before it happens is, can be quite beneficial. But what can Swiss medicine do for foreign people compared to, say, medicine they have available in their own countries?
So, well, you have good doctors all over the world. I mean, it's not that Switzerland has the best doctors ever. But what is interesting in Switzerland is the package that you get. You get really good doctors with a great academic education. You have the best technology, and you have the whole team around the doctor. Because, of course, what is important, the most important thing is the doctor. The doctor who's going to look after you for your problem. And as I said, Switzerland has very good doctors, but maybe in India you also have very good doctors. First the doctor, and then this doctor has to deal with the technology, and he has to know how to use it. So then you have really high technology that will be used by this doctor. And then the doctor needs to have all his assistant and needs really a backup team that supports him all the time. You have all this in Switzerland. You have many, I think it's one of the only country where you have so many doctors and technology for one inhabitant. It's amazing. It's huge what we Swiss citizens have at our next door. So a lot of people come here because they don't trust their medicine, because they don't trust their doctors. They come for second opinion or for all kinds of treatment. And actually, I must say that they're right, because many times we have some people coming from foreign countries with some strange medical reports saying that they need immediate surgery or they need immediate treatment, and realize that, no, it's not true. So the second opinion that they get here helps a lot, and many times they come here and they leave with a great smile and because they got some kind of satisfaction and a good answer to their requests.
A bit of peace of mind.
Absolutely, because what I can add is also our medicine here tends not to dramatize. We always try to have the people relax and not go completely berserk thinking that they're dying. So we always say, okay, take it easy, we'll see. We're not going to say it's bad immediately. And this is very important for the patients because they must feel really comfortable and not go to the doctor, okay, I have to be open up immediately, la 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 la.
Of course. Well, thank you so much for your insight today, Nicholas. It's been fantastic having you in the studio.
Thank you. It was a big pleasure.
That's all from Nicholas and myself for now. Thanks for tuning in and be sure to keep clicking back to Ducoscopy TV.